Thank you, Mr Deputy Speaker, and I'd like to thank the Speaker for granting this evening's adjournment debate on a topic that's so important to my constituents in North Shropshire, to people across Shropshire and indeed across the country. I really want to start by making it clear that I'm not here to criticise the hard-working NHS staff in our ambulance service and in our emergency departments. Indeed, I want to thank them for their incredibly hard and dedicated work in difficult and often demotivating circumstances. But there's clearly a problem in the provision of emergency care in Shropshire with complex causes, and I want to bring it before this House to urge the Government to take some action. It was clear throughout my recent election campaign and from my inbox since then that stories of excessive waits for an ambulance were not a rarity by any means. I've since urged my constituents to contact me and share their experiences. Just since Monday, my office has been met with a tidal wave of correspondence, each story as saddening and frightening as the last. The care home reporting a wait of 19 hours for an elderly resident with a broken hip. An elderly diabetic man who fell and dislocated his shoulder. He was advised not to drink or eat anything in case surgery was required, and then waited 15 hours for an ambulance to arrive. A disabled man who fell in his bathroom and waited for 21 hours for an ambulance, fortunately lifted from the floor after 8 of these hours by a helpful neighbour. The man who waited with a stranger experiencing heart attack-like symptoms on the side of the road for many hours, only to give up and drive the gentleman to A&E himself. The man with a suspected stroke who waited 9 hours for an ambulance and a further 5 in the ambulance waiting to be transferred into the hospital. The 92-year-old lady who fell at 8:30 in the morning, suffering bleeding from the head and a broken leg. She was looked after by her 75-year-old neighbour for almost 8 hours until the ambulance arrived, and then waited in the ambulance for transfer into the A&E department until 2:30 the next morning. She had not eaten since 6:30 on the evening before her fall. The elderly woman who fell down the stairs shortly after lunch. Her emergency carers, she has a red button to press for them, made her comfortable and they called an ambulance, but they couldn't carry on waiting forever. And after an 11-hour wait, she was alone with her front door open so the ambulance crew could access her house. That was at 3 o'clock in the morning. Now, I could easily spend the next half an hour relating heartbreaking stories, and I'd like to thank all my constituents who contacted me for taking time to get in touch and explain the scale of this problem. There's one story in particular that really brought the issue home, and some of you may have read about it in the newspapers. And it was a story of a young man, a young footballer, who slipped on AstroTurf while playing football at school. He dislocated his knee and waited so long for the ambulance that by the time one finally arrived, he had developed hypothermia. I don't know if you can imagine the distress of this young man and the teaching staff who stayed on in the dark long after the school day had ended, as his condition just deteriorated out in the cold. And what all these stories have in common is that they could have been much, much worse. I'm sure everyone in this House will agree with me that nobody should have to suffer waiting an excessive amount of time for an ambulance, and yet tragically in North Shropshire it is pretty common. And I know that this problem is not unique to Shropshire. I'm sure that many of my colleagues have received similar emails describing similar events. And in parts of Britain, an excessive wait for an ambulance has become normal. Now, of course, the problems surrounding this crisis are complex, and I'm not here to propose a simple quick fix. However, there are consistent themes at the core of the issue, and it's pretty vital that we recognise them if we were to work out how to move on from here. The first is the problem of handing over patients at the emergency departments in Shrewsbury's case, in Shropshire's case, in Shrewsbury and Telford. On the day the young footballer dislocated his knee, West Midlands Ambulance Service told me that 868 hours had been lost waiting to hand over patients. That's 868 hours. Nearly 2,600 hours were lost in the month of March up to the 29th. Handover times in Shropshire are significantly worse than in the rest of the country, and there have been days or periods of time when every ambulance based in Shropshire is waiting outside the hospital to discharge patients. The Hospital Trust has declared a critical incident on no less than 4 separate occasions so far this year, and each one of those incidents has coincided with an increase of these heartbreaking stories coming into my inbox. Of course, yes.
Thank you for thank the Honourable Lady for giving way, and can I congratulate her for bringing this incredibly important issue to the House, because she is raising something that is very common to all Shropshire MPs, and we all have our heartbreaking stories. Does she agree with me that it is a combination of factors, and I'm sure she will go on to discuss some of them, but a combination of factors including the transfer of people from A&E into wards, as well as inaccessibility of getting to your GP, and that's putting additional pressure on A&E?
Thank you. Yes, I'd like to thank the Honourable Lady for her contribution, and I do entirely agree with you, and I hope I'm going to address some of those points later on in my speech. The emergency departments of the Shrewsbury and Telford Hospital Trust report that they suffer from a shortage of space and a shortage of staff, and along with the additional challenges of separating COVID patients out, of which on Tuesday this week there were more in hospital at Shrewsbury and Telford Hospital Trust than at any previous point during the pandemic. The Trust also reports that there are delays discharging patients who are well enough to leave the hospital because they struggle to find care packages or care home spaces, and there are a number of care homes currently closed in Shropshire because of the pandemic. Now, Shropshire shares the national problem of a shortage of care workers and of care homes, and it's probably exacerbated here because we have a high percentage of elderly patients. The inability to just discharge patients who would doubtless be better off at home or in a care home setting just reduces the flow of patients through the hospital. But the impact of all of this is that because the ambulances wait so long at the hospital, the vast majority of them begin their journeys across Shropshire from Shrewsbury or Telford. And it's not possible to reach the most serious patients towards the edges of the county within the target time if the ambulance sets out from those two towns. This, combined with the closure of community ambulance stations, means that very few ambulances are free in places such as Oswestry or Market Drayton when somebody becomes ill and requires one. Another factor, as my honourable colleague has alluded to, is the volume of patients accessing the emergency department or being taken there in an ambulance because there isn't another option available locally, and that's particularly true at the evening and weekend. Shropshire has a shortage of GPs, which is worsening, and it's leading to patients attending the emergency department for relatively minor issues because they simply have no other alternative to see a healthcare professional. Now, one of the key reasons behind the problem of staff recruitment is the chronic lack of other services in Shropshire, but I will leave that, Mr Deputy Speaker, for another day. This government must deliver on its promise to recruit more GPs and ensure that those with urgent healthcare needs are provided with adequate resources in their communities. Now, I'm incredibly proud of my constituents, Sian Tasker and Lawrence Chapel, based in Oswestry, and beyond my constituency, Darren Childs in Ludlow, and other campaigners who've worked tirelessly hard to keep this issue in the public light and to campaign to keep their community ambulance stations open. And it's partly because of their hard work that we're finally discussing this issue here in Parliament. But I'm afraid to say, Mr Speaker, that so far the government has refused to listen to the countless warning signs of campaigners and those working on the front line. The Care Quality Commission's State of Care report last year gave a stark warning that overstretched ambulance and emergency department services are putting patients at risk. The numbers speak for themselves. As the Association of Ambulance Chief Executives found, 160,000 people a year nationally are coming to harm because of delayed handovers to A&E. Of those, a shocking 12,000 have experienced severe harm. Mr Speaker, I've repeatedly asked the Secretary of State for Health and Social Care to meet with me and with the West Midlands Ambulance Service to discuss how we can tackle the local issues together. And I'm deeply disappointed that so far he's refused that request. It seems to many people in Shropshire that the Department of Health are burying their heads in the sand and refusing to acknowledge the seriousness of the issue that we face. So I'd like to use this opportunity, Mr Speaker, to urge the Minister to meet with me and my colleagues across the county to discuss this crisis, to hear some of the first-hand accounts of those left waiting in distress, so that together we can come to some sort of solution. I have no doubt that everyone here, including those on the government benches, want to ensure that people at their most vulnerable are kept safe, and I welcome the additional £55 million of support for ambulance services that was recently announced. I do fear, however, that this money may not go far enough, or that it may not be targeted in the areas of greatest need. Shrewsbury and Telford Hospital Trust's hopes are pinned on the Future Fit Hospital Transformation Programme. Now, this programme kicked off in 2013 and is reliant on funding of £312 million, the source of which may be an interest-bearing loan, and I will happily correct the record if I'm incorrect on that, but that's my understanding. Unfortunately, more than 8 years later, a strategic outline case has still not been signed off. The estimated costs have spiralled by almost 70%, and it's likely that they won't be covered by the government. The initial promises of urgent care centres in more rural areas, one was guaranteed for Oswestry, for example, investment in community hospitals, local planned care centres, these have all been dropped during the period of the summer of 2015. And promises of investment in public health and prevention, all of which was a good idea and would have been welcome in Shropshire, are apparently no further forward. We're consistently told that there's no more money in the pot for faster, better resourced ambulance services or urgent care staff. And yet, the government's wasted over £10 billion on PPE that isn't up to scratch. I think it's time the government listened to the warning signs that they've been ignoring and finally stepped up to provide proper support for ambulance services and accident and emergency departments. Mr. Speaker, there are several steps this government could take right away to get to the bottom of the causes of all of this. The Secretary of State could commission the Care Quality Commission under powers laid out in Section 48 of the Health and Social Care Act to conduct an investigation into the causes and impact of ambulance service delays. That's a fairly simple step, and the law already allows for him to commission a CQC. Once the government's got a professional assessment of the complexity of the causes of the delays to ambulance service response, they can take the correct steps, targeted at the correct causes of the problems, to make some rapid improvements to the service. As I've outlined, the causes will most likely lie in a number of areas across emergency and social care, but until they're fully understood by the right people, they can't be resolved. The government could also pass my colleague, the Honourable Member for St Albans, Ambulance Waiting Times Bill. The bill would require accessible, localised reports of ambulance response times to be published. Once that data was available, it would enable central and devolved governments to accurately understand where the delays are and how best to tackle them. Because we should be following the data and the facts to provide the right solutions and the right resourcing in the areas that need them most. That bill's already written, it's had its first reading and it's ready to go. Mr. Speaker, the reason I brought this debate to Parliament was to ensure that the Minister, the Secretary of State, understand the scale of the problem in Shropshire, but crucially to make sure that they realise that there is an urgency in resolving it. How many more elderly citizens will have to wait for 10 hours with their front door open for an ambulance? How many more people are going to have to wait at the roadside with a stranger who they believe might be close to death? How many more young adults are going to develop hypothermia when they have initially a trivial injury such as a dislocated knee? And how many more cases of serious harm or even avoidable death will it take? I want to thank the Minister for coming here this evening and responding to my speech, and also, as I say, to the Speaker for granting this adjournment debate. And I also want to take the opportunity to thank everybody in the Chamber for coming along and to wish you a happy Easter and